to today's PCCC in public primary care commissioning committee. Have we got any director on call we need to note? Stuart's on call. Thank you, Stuart. If you disappear, we'll know why. Declarations of interest in addition to those we already have. No, okay, thank you. And minutes of the meeting held on the 6th of July, which you should have in your pack. I'll take any accuracy or matters arising. So page 3 in the pack. I wasn't actually chairing this meeting, but I was there. Page 4. Page 5. Page 6. All okay, so those are taken as approved, Helen, thank you. We got no actions on the log, which is always nice. So we're all up to date. So next item is item 5, General Medical Advice and Support Team Update for noting. Julie, over to you.
Thank you, Bev. So I'll take the paper as read. It's the usual report that comes through. You'll note that there are a couple of changes, but the one I probably would sort of just draw your attention to is the locally commissioned services, to say that we have now communicated out to the practices that the remaining of the locally commissioned services, which are highlighted on the page 12, that you can see that have been are being restarted, but obviously there is still a subject to the review that is going on, which we will be presenting to the committee in the coming months. Happy to take any questions. I think the report's quite straightforward, but happy to answer anything that anybody's got.
Thanks, Julie. As you say, we'll have read it and it's all fairly straightforward this time. Anybody got any questions or comments? No? Okay, we'll take that as noted then, thank you. Then on to primary care commissioning, substantive item, supply of gluten-free products for people with celiac disease in Northamptonshire. Kieran, I think this is you, even though Julie's down to present.
It's actually Giles,
Giles,
sorry.
And as soon as I said Kieran and I saw his face, I knew I'd said the wrong name. It's Giles, sorry.
That's okay. Thank you, Bev. And again, take it that everyone's read the paper. Just to give you a summary, though, from it. Northamptonshire PCT set up a locally enhanced service for providing gluten-free products many years ago, as these products at the time weren't readily available, and the ones that were readily available were relatively expensive. When NHS England took over commissioning of community pharmacies in 2013, they actually took over the locally enhanced service as well for the provision via community pharmacies. I've got to say that the CCG at the time decided to actually continue to actually provide the provision for dispensing practices. And that was to make sure that we had equity right across the county for patients, no matter where they actually lived. In 2018, NHS England undertook a national consultation process on the provision of gluten-free products on the NHS, and their conclusion following this consultation process was that only bread and flour mixes were to be provided on the NHS thereafter. And that was the greatest allowance they would actually allow. But the other thing they actually suggested was that greater restrictions could actually be put in place, and also CCGs could decide to actually end prescribing totally actually of this. And I've got to say, most CCGs in the preceding years have decided to stop commissioning these products. And I think the main reason why they've actually done that is that these products have become more readily available. So they are now available in supermarkets, actually stock a range of these products. And by these products actually becoming available in supermarkets, then it means that they've actually come down somewhat in price. So they are relatively, well, the price is actually comparable to their gluten equivalent now. In December 2020, NHS EI for the Midlands region informed Northamptonshire CCG they were undertaking an engagement process about the future commissioning of the service from community pharmacies in Northamptonshire. The results from the engagement questionnaire were that they had 251 responses. 65% of these were from patients, and 82% of the respondents thought that the scheme should actually continue. However, the NHS England actually took this away and actually considered it, and then they subsequently informed the CCG on the 28th of June that they would no longer be commissioning the service from the 30th of September of this year. And the reason they gave was that they do not commission it in any of the CCG, so it was not equitable for them to actually continue this. NHS England actually requested within this letter that CCG consider the provision of gluten-free products from the 1st of October. So that's obviously why I've brought this paper today to PCCC so that we can give it due consideration. In considering that, we need to know that there's about 800 patients who we've currently got on the scheme within Northamptonshire. And since NHS England have been actually paying for the scheme within community pharmacy in Northamptonshire, which accounts for about 90% of the costs, if the CCG was to commit to continuing to provide gluten-free products for celiac patients, it's difficult to estimate, but it's probably around a cost pressure of about £300,000 a year that we're actually looking at. Furthermore, the other issue in this is that the CCG does not have the facility to actually pay community pharmacies via the scheme as NHS England did. So what we'd have to do is that we'd almost have to stop the scheme anyway, but if we were to continue to provide it, it'd need to be prescribed via GP practices, and that in itself would create its own issues in the fact that GP practices haven't been used to doing this, and therefore they almost need to get some training on sort of what was required for these patients, but also, as I'm sure you're all aware, that the system's currently under pressure anyway at this point in time, and it'd be a further workload for those GP practices. So bearing in all this in mind, it's recommended to PCCC that to support gluten-free bread and flour mixes not being available on the NHS in Northamptonshire for the following reasons. The products are readily available and additional costs are relatively marginal. The cost of the products to the NHS is expensive, even without considering the administration costs. So again, we use something called chemists and druggists to actually reimburse the pharmacies, and the actual cost that we reimburse the pharmacies for, say, a loaf of bread is a lot higher than what it would be within the actual, if you were to get it from the supermarket. So it's not a particularly efficient system. And other CCGs have decided it's not equitable to provide this in line with other healthcare requirements. And I've got to say, in Derbyshire, they did do an EQIA to actually, and as part of this, they sort of acknowledged that the decision may particularly impact on certain groups, e.g. low income, but again, they still decided to actually go ahead and almost provide dietetic support really for those patients. Within Northamptonshire, dietitians do actually see these patients, and they'll endeavour to continue to support celiac patients to mitigate against any issues really from stopping this service. But it is to highlight that their service is stretched. It's obviously not only celiac patients they see. And the other thing that I would like PCCC to consider there is that if it was decided not to commission this moving forward as recommended, whether we actually use some of the money to actually reinvest in dietetic services. So we think we're probably spending about £25,000 a year on dispensing practices at the moment. So it's whether we look to, is there a way of reinvesting that money? So that's the summary for me. Thank you, Bev.
Okay, thank you, Giles. That's very comprehensive. And just before I take questions, so just to clarify, because I found the paper a little unclear. So on the recommendation under on page 17 in the pack, it's saying the committee is asked to take on board option 3, which is to not commission the service, but then later down on page 18 it says but actually to support option 4 potentially, which is to recycle, reuse some of the money for the wider service. So 3 is to stop it and do nothing else, and 4 is to recycle some of the additional funding, and actually the recommendation is that we go with option 4, just so that I'm clear.
Yes, I'd like to really get the committee's views on that, but that would be my preferred choice.
Okay, that's fine. Right. Okay, so I'll open it to questions. I'm not sure who went first, but I've got Stuart and then Kieran.
Thanks, Bev. So obviously, I'm overall supportive. The bit I'm going to question is the reinvestment. I think that reinvestment would need to go alongside all the priorities that we're trying to do, because we wouldn't want to single this out first without looking at all the priorities for the system. But as the system's developing a prioritization matrix, we don't want to start committing stuff before we've had a chance to look at that. That would be my comment.
And there isn't so on that, there isn't an element of ring fencing of this money if we were to decommission, then, Giles, Stuart? No. Okay, I think that's good point, Stuart. Kieran?
Giles, we were talking about this earlier in the week, and correct me if I'm wrong, the way NHS England have managed this, or not, hasn't supported the pharmacists themselves, and I don't think we're even sure at this stage that they have actively written out, and this is, I suppose, the bit I'm checking, that actually written out to the contractors, and I know Giles and I have spoken about this offline, but if not, part of maybe our role is escalating that back in order to ensure they follow their own contractual mechanisms to provide the correct notice, which might buy a little bit more time of service at the very least. But I know that that's something you and I need to pick up outside of this. But am I right? I suppose Giles is.
So I'm not entirely sure. I know that the LPC were aware, so I would have thought most pharmacies were aware that it was actually ending end of September. As you're aware, Kieran, it's been quite a tricky situation really as well, in the fact that obviously the NHS England reached this decision they weren't going to continue, but until we knew exactly what we were going to do, it was quite difficult to contact the community pharmacies to really give them a view on what the future was going to be. So I was really waiting for this sort of meeting today, and then I think we can then very much pick up and check with the community pharmacies what communication has gone out.
Thanks, Kieran. Sanjay? Unmute, Sanjay.
Is that any better?
Yep. Okay,
cool. So regarding the costings and that, my son has celiac, so I know about the costings very well because I have one who is and one who isn't. There is a discrepancy in there, so I lead on to the EQIA bit here in terms of those low-level families, because there is that difference, and stats for Derbyshire. Do we need to do one for here for ourselves? Is the first one. Second one was, do we have any idea what neighbouring CCGs are doing? Because I know Leicestershire are still providing at the moment. And that leads on to my third one, which is the comms piece, that if we stand out as Northamptonshire stopping and our neighbours are continuing, then we're up against another media backlash. I can just see it happening, having dealt with this for the last 6 months for other reasons.
Yeah.
So just before you answer that, Giles, and I know we had a conversation previously, Sanjay, about, so I know your son's affected, but not in the Northamptonshire area, so I don't want anyone to think that there's a conflict with your contribution to this, just to be absolutely clear for the minutes and the public record. Giles, can I ask you to respond to Sanjay?
So your first question around the EQIA, Sanjay, I don't think it was very comprehensive, the one they did in Derbyshire, and I haven't got any reason to think that our population would be different within Northamptonshire. With respect to your point number 2, really around Leicestershire, that I know that they're currently looking at it with the thought of that they will actually be stopping it in the not so distant future. Their scheme is currently more restricted than ours anyway, I believe. And then with respect to other surrounding CCGs, we're a bit of an anomaly. Most of the CCGs have actually stopped it, and NHS England make reference to that actually within the paper, that I think they only cite Cumbria as the only other CCG. Now, that's not quite right if Leicestershire are still doing it, but they are relatively few and far between.
And I think the other bit to put in, I think this probably goes into the EQI, which supports the paper, is that this is one of the only things where an allergy to a certain food product is actually subsidised by the NHS. If we look at someone who has severe lactose allergies and that, there is no funding or stuff available on prescription. So I think that kind of counterbalances on the EQI. Thank you, Giles.
And it's another analogy is diabetes as well, isn't it, with sugar-free foods and things.
Yeah.
And I don't think Cumbria is a neighbouring authority, or wasn't last time I went to school and did my geography lessons. Amar.
Thank you, Bev. Yes, I mean, certainly in Leicestershire, I wasn't aware that they had actually stopped it. But yes, thanks for updating us there, Giles, because I remember over here having a bit of a convoluted system when I was working in Leicestershire with the number of units he calculated for the gluten-free products, which was quite complicated for both patients and for the clinicians actually prescribing. But yes, I mean, I've heard both sides of the arguments, not just for my own patients, some sort of who are sort of pro it being on the availability and prescription, but also equally, some saying that it's much more widely available, so they're much more keener for it to be not on prescription because of the cost of the NHS and other vulnerable groups, other groups not supported, like diabetics, for example. I just had one question. I was looking through the paper, and I saw you'd obviously got views from patients, but I just want to know about the third sector, like, for example, celiac charities, and whether they had been consulted at all as to, maybe not in terms of this particular decision, but how best to utilize any funding. I know you've mentioned the idea of supporting the dietetic service, but was there anything else that they came back with as to what other areas are doing, maybe some novel ways of helping celiacs to access, gluten-free products, for example, in a bit more understanding and easier way to sort of navigate that?
So Celiac Society is really quite vocal, to be honest, actually, on this. And they were aware of what was going on. So I think that they responded to the actual engagement process with NHS England. I've got to say, I haven't had a conversation with them directly around, future reinvestment, because again, needed to actually bring it here for views of the committee, but also taking in it's sort of thinking about the comments Stuart made, really moving forward around commissioning priorities and where it actually fits around that. So we'd need to do that. As I say, the Celiac Society have written to us, so I think the plan will be to actually meet up with them after we've actually made our decision, and then actually discuss that further with them, and then we can maybe explore at that point if there's more we can do.
Thanks, Giles. Karen?
It's just relating to the EQIA. Yes, I take it that Derbyshire's is quite in depth, but that isn't about our population and about our patients. And I think we would be challenged on the fact that we're using somebody else's EQIA. So I think it would be useful to have that reviewed locally, just to make sure that we've got an EQIA with Northamptonshire on it, because we wouldn't want a challenge of basing something on a different county.
Okay. Julie, you looked as if you were poised to speak.
Yeah, I was just going to thank you, Bev. I was trying to find the mouse. So obviously this service is managed by NHSCI. So I'm just wondering whether or not, I would have assumed that they would have done that EQIA as part of the work around that. So I think it may be worth us just asking the question, because as I said, that they should have actually done that as opposed to us. But I think it's worth that linking in. So Giles, perhaps if you could pick that up just to feed in and say what, but because I mean they went out and did the engagement piece on the back of that, and on the back of them going and saying they want to decommission this, they would have had to take that through their committee as well, which probably links back to the point that Kieran was making.
Okay, so do we know the answer to that, or do we need to seek clarification on that?
I don't know the answer to that. Or the only other thing I would say is that obviously, and it is different, but when they did their national consultation process, they obviously did an in-depth EQIA at that point. But that was national NHS England, not regional.
Okay. Any other comments from anybody else before I try and sum up where we are? Okay, so I think, and I will ask you to vote on this in a minute, but I think I'm hearing that the first step, which is to not commission any longer, to decommission the service, is agreed. And then I'm not seeing any objection to looking at recycling some of the funding that goes into this and engaging with appropriate people such as the Celiac Society and anybody else that might inform how best that's done. However, Stuart's original point of that needs to be done in the context of and manage the expectations of that because of the ICS priorities work that's being done. So I think that's a conversation that can be had, but not a guarantee that can be given, subject to that happening. I think I'm going to propose that we approve the option 4, but as a caveat to look into the EIA with NHS England, and if there's anything that's flagged up that would be counter to that, although it's sounding like that's not likely to be the case, then you would need to bring it back. But subject to that, if that could be brought back by email to the committee that work's been done, then we'll move to approve it. Is that okay with you, Helen, in terms of capturing that for the minutes?
So, Bev, can I just check as well? So we've obviously now got this deadline of the 1st of October that the pharmacies will need to be made aware. So is it the fact we almost contact them and make them aware that it's definitely ending 30th of September as per NHS, ending their actual locally owned service with them?
I mean, I think I'm getting nods that that's the case, but obviously we'd want the NHS England conversation about the EIA to happen as soon as possible, just in case that throws something up. But I'm feeling like that's not likely to be the case, so we are safe to have that conversation. So I'm assuming you're okay with that then, Helen. So could people approve in the message box, please, that item 6 you are happy to approve? And you've got mine, Helen, so I think you've probably got sufficient there.
Yeah, that's a correct decision.
Okay, great. Right, that brings us to the end of items. The next public meeting is on the 2nd of November at 2:30. Unless anybody's got anything they want to raise before we close off. No? Thank you very much for your time this afternoon, everybody, and I'll see some of you in 5 minutes' time.
Thank you.
Bye.